is a privilege for me to be here. And as you're quoting that, the Constitution, I can see Professor Kivuta Kibwana, who is here, who's one of the architects of our present Constitution. So, Professor, we're very honored for you to be here with us. As I listened to Agatha Juma talk about the things that affect us as human beings and as Kenyans, one of the things that she mentioned, the quote, and I think I asked whether I can borrow it, and I'm borrowing it, is Kenyans' third language is silence. I met this gentleman, it was on a Monday. I had a clinic, usually had a clinic, so from around 9 o'clock in one of the hospitals. And this day I came a little bit late because I'd been caught up in KNH doing some work there. There was a line of patients, and he stood out because he was very agitated. So as I finished with the other patients who were before him, and I ushered him into the consultation room, the first thing he asked me, Daktari, why are you late? And of course, in order for me to not to do anything, I just said, I'm very sorry. I had apologized that I'm sorry I'm late is because I was caught up elsewhere. But I said, I'm very sorry, but it's because of other duties. It's not that I intended intentionally for me to be late, to keep you waiting. So I took the history. I said, what is the problem? Even before looking at what results he had, I took what you call the medical history, you know, how many years, how old is he, allergies, etc., etc. Then when I finished, I asked him, so how can I help you? And he showed me results of a sperm test. In the medical history, one of the things that we ask is, are you married? Yes, I'm married. Do you have children? Yes, I have children. How many? He had 3 children. That is with the first wife. So does it mean you have a second wife? He said, yes. Presently, I have a second wife, and the second wife is actually expectant. I said, okay, that is beautiful. How many weeks? It was about 20 weeks, which is about 5 months. Then in my mind, and she had come with another baby. So then in my mind, I was asking, something is not right. You're coming to see me. You have 3 children with the first wife. The second wife is expectant, even though she came with another baby. So why the hell are you coming to see me? Anyway, so he showed me the results. And guess what? It was a sperm test. And there was no sperm. Azoospermia, what we call azoospermia. There was now that restorative justice when I check them. Anyway, so I told him, well, he tried to explain to me. I said, so I asked him, if you have 3 children, your wife is expectant, 5 months expectant, why did you do a sperm test? He said, well, it's because 3 years, some time ago, I was in a relationship, and I was in this relationship for about 2-3 years, and we broke up, and the lady told me that I am infertile. So that thing has stuck in my mind all along, even though I have these children. So I decided to go and do a sperm test. And I did a sperm test, saw a doctor, and that doctor referred me to you. So I said, well, let's do some other tests. Maybe there was an issue with the lab, maybe. So let us do a fresh test so that we see what the problem is. Did a fresh test. He was very diligent. The following week he came, did another sperm test, and guess what? Nada. 0. Nothing. So I said, okay, if you have an issue with lack of sperms, there can be different issues, there can be different reasons. It can be maybe an infection, maybe there's no production of sperm, etc. So let us do some other extra tests. We do a blood test to look at the hormones. We do a scan to see whether the testicles are in the scrotum. Sila tunaongea vitu zote. So we can talk about testicles, we can talk about sperm. Sindio? So this is what was in my anyway. So he did that test and he came back. So the blood test and he did a scan. The scan came out that the testicles were tiny, what we call atrophic, tudogo. And the blood test, the results that came out is that the hormone levels were elevated, which basically meant that he was not producing sperm. Na watoto wako na wangapi? Watatu wako nyumbani? And there is one where in Kwatumbo on the way. So he said, is there any other test that we can do? He said, yes, there is another test that we can do, but that is the last one. Basically, what we do is what is called a biopsy, testicular biopsy. We go and remove a small piece of any tissue, and this tissue is a testicle, and send it for analysis so that you can look at it under a microscope, and a pathologist, a specialized doctor, will tell us what is happening. And after a week, he came back with the results. And basically what the results said is that there is what you call primary arrest. Meaning, usually in the production of sperm, there are stages. Ni kama mtu kwenda shule, anaenda nursery, primary, secondary, and then you are mature, go. So the same thing happens when there is production of sperm. So this one had arrested at the primary level. Meaning, remember, hormone levels are elevated, testicles are tiny, and now we have actually confirmed that there was this production of sperm, lakini zimekwamia pale at the primary level, meaning there was no sperm all along. Watoto watatu wako nyumbani, mmoja yuko kwa tumbo, and there is no sperm. Watoto ni wanani? Wa Mungu, wasikia wanasema watoto ni wa Mungu. So I was in a very precarious position. So I talked to him. I kept on insisting, is there something else I can do? I said, unfortunately, we have reached the end of diagnosis. And is there any treatment? I said, treatment cannot help you a lot because your hormones are very elevated. If I were to give you medications, it's like adding fuel to a fire. So it will not help. So essentially what we are saying is that there is no treatment for you. So he kept quiet. And then he asked me, so Daktari, who are these? Whose are these children? Thank you. So I say, that's a difficult question for me to answer. But I tried to sort of soften the blow. I said, look, when you're a father, there are different types of fathers. There are two types of fathers, essentially. It is good if you are both of them. The first one is you're the biological father. You have given the genetic material. Your sperm, has gone into the development of this child or these children. The other one is a social father. It is good if you are both of them. You are both the biological and the social father. But in this case, you are the social father. These children don't know anybody else. They only know you as the father. You take care of their needs. They call you daddy, pay their school fees, etc., etc. Which is a good thing. And then I asked him, do you want to talk to somebody? Psychologist, maybe? He said, yes, I think I need to talk to somebody. Ni watu wa masharubu, the way men are, we feel big. I have nothing against people who have masharubu, by the way. So I told him, okay, I was going to organize a meeting with a psychologist, but I never saw him again. Breaking the silence. Kenyans have a third language, and that is silence. We do not talk about infertility, especially when it touches men. Men, where are you? Oh, you are here. Mbuko. Nasiana Justus yuko hapa. I have never sat on this chair. I know it has different implications, but who knows? Maybe one of these days I'll sit there. Infertility affects 20% of the Kenyan population. So if the Kenyan population is 50 million, and we say half of that are children, and the other half are, us who were here and others in the reproductive period, so about 25 million. So if you take 20% of 25 million, that's about 5 million Kenyans. So imagine the whole of Nairobi, throw in Kiambu, maybe throw in Kajiado, and maybe Machakos. So everybody is affected with infertility. And then the other thing is that we talk about mama ikiwa mama hajaonekana tumbo, so it means she's the one who has a problem. 40%. How many did I say? 40% of the issues of infertility ni nyinyi wanaume. Nyinyi. Unasikia wanasema amen. 40% the problems are ours. But why do the ladies bear the brunt? It's because they are the ones who actually manifest the work, the difficult work, which has gone on behind closed doors. Lakini sisi wanaume mbele iko sawa. Which is not true. We have issues with erection. Si tumesema leo tunaongea. We have issues with erection. We have jana, I had a patient, couple came to see me, and as we are talking, we finished. I could see the way the lady is talking to me, the body language. Anasema, daktari kuna kitu nataka nikuambie. Nikasema, najua mzee tukienda kufanya ile mambo yetu, wakati yuko standby. You know what is standby? Twende sasa kwenye bedroom, akiingia tu amemwaga. Sasa naniacha, mimi niko na shida, kichwa inaniuma. We have issues with erection. We have issues with premature ejaculations. We have issues with lack of sperms. We have issues with retrograde ejaculations. We have issues with... Mwingine alikuja akasema, daktari, I don't know what I'm going to do. Mzee akifanya mara moja kwa miezi miwili yeye ametosheka. Naona wengine wanaangalia chini by the way. So men, we have a problem. That's why I want to thank Justus for inviting me here. For this program, we have to break the silence. We have to break the silence about infertility, and not only about men. Women who bear the brunt of this big issue of infertility. Thank you.